Recently, it was published the new recommendation from the EMN for the treatment of the plasma cell leukemia, okay, in SOHO oncology. Of course, in transplant eligible patient, we need a quadruplex, Dara-VRd or Dara-VRd. Outside Italy, okay, we can use also the thalidomide. And the transplant, consolidation and maintenance. What's the problem? Then we can use 4 cycles for the patient that have, after the induction, a CR or MRD response, or 6 cycles for the patient that don't achieve this response, or the double transplant, or the auto transplant and annual transplant for the patient that are refractory or with a not optimal response to the therapy. For the non-eligible transplant patient in the plasma cell leukemia, we need a quadruplex, Dara-VMP or Dara-VRd. In the frail patient, exclusively an doublet therapy. We can use a chemotherapy and allotransplant for the relapsed and refractory patient if achieve optimally the response. And a new treatment could be the venetoclax. For the extramedullary disease, we need a chemotherapy because the real extramedullary disease is an emergency. For example, the skin, the central nervous system, for example, on the lung, we need a chemotherapy plus the novel agent. VRd, Dara-VRd pace, for example. The transplant, maybe the double transplant is possible. For not transplant eligible, also the quadruplex. This is very important. For the Repso treatment, we have the possibility to use the calfizomib, for example, and the other treatment, but this is the future for the treatment of this patient.